So 5 key questions that we typically get asked when a clinician is moving from NHS into private practice in the PFD group. And one of the first questions that is they ask about is what happens to my NHS pension. So your accrued pension so far is completely safe. That's within the NHS system. And what we do is that because you're not going to be continuing to any great degree within the NHS system, we have specialist advisors that come in and work with you and help you develop private pensions. A lot of dentists have a lack of awareness that we come in, we tend to graduate, are told that there's this NHS pension system. We're kind of being told that we think it's good but don't really have an idea, and as we get later in our career we start to look at these things. So what we do is make sure that from the start you're set up appropriately, you have appropriate advisors, and we have our own recommended advisors that will help get you set up, whether that's through your accountancy, but a lot of the time it's through the independent financial advisors that we help you get set up in pensions and support you what to do. We've got a long track record of proof of our other dentists through the period of time of what they've invested in and how they're protecting their future for themselves and their family. So that's number one. So pension in the long term is a non-issue. What you've got in the NHS is there saved, but we can help you in the other areas to maximise that long-term benefit, and you will do better than just going through the NHS system with the NHS earnings that you're putting into that system, and when compared to being able to do it with a private pension. The second big question and the concern is, will I be busy enough? And the short answer to that is yes. Now, it's slightly different when you move from NHS into private practice. NHS practice, and we're trained to think a certain way of just get my book busy. If you get my book busy, I'll be productive. Get my book busy, I'll be productive. And we move from a different system. That the goal in private practice is not to be busy. That's definitely not the goal. The goal is to provide high quality dentistry and a high quality patient experience that will result in you being busy enough that you can make a very, very well rewarded income for yourself. And what we see is that clinicians, as they move and we come into private practice, they're not really quite sure how that works, and maybe start moving into that treadmill type thinking. So the goal is not to be busy. The goal is to give great patient clinical care, great patient experience, and be productive. But what we do is we model exactly what your income will look like. Okay, now there is obviously individual variation. One clinician takes 20 minutes to do a procedure, another one takes an hour. There is variation in that, so this is where we have to work together with you. Now, what we do know is that as you come through and you progress through our system, you have an income well above the average income for dentists on the NHS, and even the highest earning dentists on the NHS. Our dentists are able to dramatically increase their income beyond that. So personal income is not an issue of great concern for us, because we know we're able to improve things for you. But that's a collaboration. We don't say, off you go and here's your handpiece and here's your burr, as was when I first started in NHS practice, and you told to kind of toddle on your way and get your head down. We want to work and collaborate with you. We have a full suite of training. We've got a residency pathway, and what that allows you to do is get a really enjoyable career, be well rewarded, do great dentistry that you love. So will you be earning a great income? The answer to that is yes. Third question is, will I lose all my NHS links? And the short answer to that is not always. We have, in the Pain Free Group, we have a number of completely private practices, and we have a number of practices that are private for adults and still see those kids of those adult member plan patients on the NHS. So we walk you through the options of what you can do, what the practice has at the moment, and what it's planning for the future. And that's something, again, for you to get clarity on. Number 4, and this is a big one, but doesn't often get spoken about. What if I'm not confident talking about fees? Obviously, if you are working in NHS and you're treating a lot of exempt patients, you don't have to worry about talking about fees. And obviously with the lower fees that the NHS provides, it's become less of a concern, particularly when you're not the person that sets them. When you move into private practice, the practice sets the fees. And being perfectly honest, our practices are typically high fee, and that at the early days can sometimes make clinicians feel that little bit uncomfortable. And what we see is a progression for those clinicians, and it turns pretty quickly. but it's not like a light switch and you don't realise at the time when things start to turn. So I think the big thing that you'll realise is when you come into our practices is that our TCOs do a lot of the heavy lifting for the fees. We want our dentists to focus on the clinical outcomes, the clinical care, and the patient experience. The TCOs do a lot of the heavy lifting and be able to talk about fees for your patients. But you'll be trained, we do a training day, I deliver that myself, on how to communicate to patients. And talking about fees is one of them. So that you can clearly understand the value and affordability for patients and help them get the treatment based on their values, as well as that being matched up with the appropriate care that you diagnose as a clinician. So you can have those in-depth conversations with patients, supported with treatment coordinators to get the best patient outcome. The big thing with treatment coordinators is they have the luxury of time and availability for that commitment to spend going through everything with the patient that dentists quite simply do not have. And we don't want you to have that luxury, because your best position is to be delivering care, not talking about the fees. So we're there to fully support you. It's not something you can completely step back on. You need to be part of the discussion with patients. But as I said, TCOs or treatment coordinators do a lot of the heavy lifting and are able to support you in that direction, where fees are not the issue, but they can be an issue, but we have a pathway of being able to support our patients to help them choose the right treatment for them that meets their needs, as well as is able to meet their financial commitments as well. The final question is just a general blanket question that I get, is just how risky is it? How risky is it? I'm moving from NHS. It seems to be a reasonably comfortable position for me at the moment, but things are maybe changing a little bit. My practice isn't really investing in the equipment that I would like to see. There may be some changes in the remuneration percentages, which then result in me having to either produce more dentistry, work longer hours, or work faster. Now, our goal is never for that to never be the case. We are high fee, we have a different pay scale system, but it works out for both dentists and practice, and we find an appropriate balance that way, and we will, as I've said before, we'll model that to make sure it's abundantly clear. But let's be clear that nothing in life is risk-free. Okay, we understand that you're taking a step, and we want you to understand that we're there to support you. This is about collaboration and minimising any risk. When you move into practice, in private practice, you get to spend time with your patients. You get to co-diagnose, you get to use our systems, and whether that be through our full assessment system, our 51-point examination, our 16-point dental health review, our AI diagnosis on radiographs. We want to be able to get you to a position where you are delivering the best care for the patients. There is no real push for time, although you want to focus on levels of efficiency and not wasting time for yourself. But we want you to become part of a team that's delivering great care to patients and really commit to developing your skills. So we try and minimise as much of that risk as possible by plainly making clear what the expectation should look like, where your salary should be, how many days and how many sessions you'll come into a practice. And if that's something that you're maybe feeling a little bit unsure of, you can start off on 1-2 days a week. Ease yourself into the practice, start to build your diary from there. Obviously, if you're taking over from another dentist who is, and as we've seen recently, retiring, and you're coming in and you're taking over a full diary, great, that can be a position. But a lot of the dentists that we see coming in are thriving and building as they go, and building their book, because we see a huge amount of demand, so many of our practices, I should say, and great opportunity within that. So really, let's start a conversation. We will be open and honest and clear. There is nothing without any risk. There is risk of staying within NHS practice at the moment, and what we see is putting in a system where we see our dentists thrive, both in terms of their happiness in the workplace, the reward for the work they're doing, and their remuneration. So let's have a conversation, start with our team, let us know how we can help you understand even better.